Hello, and warm welcome to all of you joining us today for the SIO May webinar on empowering nurses in integrative oncology. We are thrilled to have you with us today to learn more about this topic. My name is Morgan Denault, and I'm a member of the SIO staff and will be your host for today's event. We have an excellent presentation lined up for you today featuring Eugenie Spiguel, who will be sharing her insights on empowering nurses in integrative oncology and providing a guide on how to understand and join this movement. Eugenie is a highly experienced oncology nurse and has dedicated her career to the integration of complementary therapies into conventional cancer care. A licensed holistic nurse practitioner, a board-certified adult primary nurse practitioner, and a PhD candidate at Pace University, she has over 20 years of oncology nursing experience. She has worked in a variety of hospital and clinical settings, including both inpatient and outpatient, with both pediatric and adult oncology patients. She was the first nurse in the integrative medicine department at Memorial Sloan Kettering Cancer Center and worked to develop the role that she's had for the past 5 years. She is passionate about integrative oncology, empowering nurses to use their knowledge and skills to improve the lives of oncology patients. We encourage you to use the chat for any technical or audio issues that you have today, and the Q&A box to send in any questions you have for the speaker, who will happily answer them at the end of the presentation. Resources from the presentation today will also be distributed to attendees at the end of the presentation. And finally, don't forget that the recording of today's webinar will be available to SIO members on the profile for the next 6 months. And after that, it will be available on the SIO YouTube channel for everyone to access. So without further ado, please join me in welcoming our speaker to the virtual stage.
Hi, thank you so much for having me. I'm just going to share my screen for a second. And away we go. So first, I just want to say Happy Nurses Week to all of you. We're going to hopefully start this off with a little bit of pro-nursing power here. The reason why we came up with this webinar is because in the Society for Integrative Oncology Nursing Special Interest Group, we were kind of just talking about various roles that we have and what we do. And I know in my current position in integrative medicine in a cancer center, I get a lot of nurses reaching out and asking, what do you do? What's going on? So we thought, let's create a little webinar and see if we can't spread the word a little bit. Since this is a CME credit, we do have some learning objectives. So we're going to try and distinguish between integrative medicine or integrative oncology and alternative medicine. That's a very important distinction. We're going to describe some roles for the integrative oncology nurse and identify common barriers to implementing an integrative oncology practice, and then describe how, as oncology nurses, we can implement some of these things into our daily practice. So first, what is in a name? This is the integrative versus alternative, right? There's a few different names that we might use at any given time, and traditional therapies is one, and that's more things that are based in the culture itself. So you might think of Ayurvedic medicine as kind of a more traditional therapy, and then some of the integrative modalities we use can also be kind of traditionally based, as, for example, acupuncture or traditional Chinese medicine, right? That's also included. Then we have alternative therapies, and this was the primary way we would describe what we do, right? Alternative medicine, complementary and alternative medicine for a long time was how we used that term, and it's really in place of conventional medicine, right? So rather than going with chemotherapy, you're going to do something completely different in many cases. So that's, I think, very important. And then complementary therapies are things that we use together, right? In addition, so maybe using acupuncture or massage in addition to the regular care. But then we get to the integrative medicine, and this is really where we are taking all of these things and truly integrating them into the plan of care. So rather than having someone, getting their conventional treatment and doing something way over here that's completely different, we're going to try and build the plan so that it's all together, right? We want to consider all aspects of not just the patient, but all aspects of care. So we're sitting kind of right in the center of this Venn diagram. That's where we shine, so to speak. So who is an integrative oncology nurse? All of you guys, right? Everyone that's here, everyone that's an oncology nurse or cares for oncology patients or is interested in oncology and integrative medicine, we're all part of that, right? My co-presenter, Heidi, and I worked together, and when Heidi was looking for an integrative oncology position or looking what that looks like when she was going for her current position, she was trying to research and she didn't find any integrative oncology nursing positions. It's not like labeled usually, integrative oncology, this is what you do. And myself, even in my own practice, I was using some of these things in my very traditional kind of nurse practitioner role in an outpatient oncology clinic. And yet it wasn't really considered, or I didn't consider myself like an integrative oncology nurse practitioner. I was just a nurse practitioner that might use some of these things. But the reality is that that is what it is. That's it, right? You being in a position where you are using or researching or whatever these different modalities or talking about them, that's integrative oncology nursing. So you might not necessarily find the one thing, but through this webinar, hopefully you'll also see how you can incorporate it into any type of practice, wherever you are. So integrative oncology nursing is, again, kind of just this idea that we're really trying to mesh mind, body, and spirit. We're trying to incorporate, what do patients want? What are their goals, right? Maybe they don't want to take nausea medication or a stool softener. Maybe they want a more natural therapy. Maybe they need a little bit more help or support in other aspects of their care. So it's really just very holistic and managing to open up the toolbox, so to speak, and really incorporate more things. The other important part, right, is just what kind of roles can we play? And this, I think, can be so broad. And what is beautiful about nursing in general, right? We can kind of work in so many different areas. We can do so many different things as nurses, and it's no different in integrative oncology. So some of the things where people might work in research, right? Nursing research, in looking at different modalities that are good, different, what are patients looking for? What are their side effects or treatments, and how can we impact that? In Society for Integrative Oncology, SIO has done a remarkable job here, right? Incorporating and changing guidelines through ASCO, right? Integrative acupuncture for arthralgias in breast cancer. The nursing research really helps drive these things. You could be an acupuncturist, right? Or a massage therapist, even as a nurse. You can get certified in these things. You can do that at the bedside. A yoga therapist or a personal trainer. This is kind of a new area of research, or I guess even activity, is psychedelic medicine. So there's been a lot of movement here in looking at things like psilocybin or MDMA for help with major depressive disorder or anxiety or PTSD. And nurses can be trained to help deliver these therapies to patients, which I think is very exciting. Programming, right? Integrative oncology programming, so important. Whether that's for staff or patients, very interesting field as well, and can be widespread. And then even like health coaching, nurse health coaching, holistic nurse coaching, cannabis nurse, all of that is also can be a part of it. I really feel like there's no limit, right? There's so many avenues that we can take. The field is new but growing, so we can really take advantage and build out what we want. So I wanted to touch a little bit on integrative oncology nursing around the world. It's not widespread as far as my knowledge of this. The nursing special interest group, the SIG in SIO that I'm a part of, they reached out to a few different nurses around the world to find out what are they doing. If you are outside of the United States, or even if you're in, please pop in the chat, like the Q&A, what you're doing, where you're working, and what you're using, because I think it's really helpful for everyone to see the possibilities of what can be done. But so for the interviews that were done, there was someone in Turkey who she said that they're limited in providing specific therapies, right? So they can't necessarily, help prescribe for herbs and supplements or things like that, but they're leading a lot of research in this realm, teaching nurses and patients, and then supervising nurses in this field, which is oh so important. In Germany, that nurse was working as a nurse educator. Also, a lot of advocacy and education and health equity and social determinants of health in this field, which I thought was really interesting. And then in Israel, again, a lot of patient and staff education and research. And then they were leading a lot of group therapies. So I think things like, mind-body work, things like that. And kind of leading off of that, I did a little bit of research into just kind of what different parts of the world are doing. So I think this is helpful, again, to kind of know if you are outside of the United States and you're kind of curious, well, how can I get involved? Or even if you're in the United States and you have patients that are from these different areas, it might help guide you a little bit as to what you can recommend or what you can really expect when you're talking to patients. Because again, integrative oncology, we're really trying to get involved in what the patient wants, right? What they're looking for and meet their needs that way. So when I was looking at this, Latin America uses a lot of natural products and supplements, I think maybe more than in the United States. And that's maybe coming from more traditional therapies as well. And then a lot of mind-body therapies. And what I thought was interesting was the horticultural therapy. So this is gardening, but in a therapeutic way. So I don't know a lot about that, but I thought that was very interesting. We know nature can be quite healing for many people. In Africa, this is especially the low-income countries, there's very limited access to diagnostics, to screening. There's a lack of infrastructure. So the patients are often not able to be diagnosed until very late in their disease because of that. Interestingly, MSK is doing some research in this field and sending people out to train these providers in the more remote areas so that they can get early screening and detection. But this just means that a lot of patients are using more traditional herbs and supplements as their only treatment, their only cancer treatment, just because they can't access more conventional therapies. And then in India, as I mentioned before, Ayurveda is very popular. And then of course, yoga, naturopathic medicine. They use homeopathy, some of the other countries as well. That's something that's really kind of poo-pooed in America, at least in my experience. In India, the Ayurvedic medicine, it's usually you have your oncologist and then you have a separate Ayurvedic practitioner. So it's not really integrated, although they're used together, if that makes sense. As opposed to like China, who they have more an integration of traditional Chinese medicine. So, the oncologist might prescribe an herb along with your treatment to help manage your side effects or whatnot. And then of course, herbs, Tai Chi, Qigong, and acupuncture are very popular. In the United States, I mean, I can talk, a little bit more about this, but basically there's 45 NCI designated centers that have integrative modalities. Those are typically things like acupuncture, yoga, massage. In my experience, herbs and supplements not used as much, especially, when combined with therapy. A lot of oncologists are very nervous about the use of herbs and supplements, and homeopathy, not popular. For patients maybe, but not so much in the hospital. In Europe, a lot more homeopathy, and then the mind-body practices as well, and a little bit of herbs. And then Israel, kind of similar, right? Herbs, homeopathy, acupuncture, mind-body therapies. So that kind of overview of around the world. And again, just if you have any experience or familiarity or you're doing anything in those spaces, just pop that in because I would love to hear about it. Now I wanted to move on to the barriers, right? Because this is a real issue for integrative oncology. And I think this partly stems from the fact that we were alternative, or it was alternative for a long time. So as we're moving to kind of legitimize our field and build our evidence base, what are the things that are stopping us? And then how can we really overcome them? So the first and foremost is the scope of practice, right? So depending on, in the United States, what state you live in will determine what your scope of practice is. I did find a link where you can find your Nurse Practice Act, so feel free to use that and look it up. In various countries, it's obviously going to be quite different. So depending on where you live, you should be familiar with what you're allowed to do and say and teach and all of that. But the things that we can do to address that are, even in the most limited scope of practice. So let's imagine we are not allowed to really recommend or do anything. At the very least, we can listen to our patients, hear what they want to do, and try and guide them at least to the pros and cons, right? So for example, somebody that wants to take an herb or a supplement, this has happened to me in my own practice, they want to take something and the oncologist says no. If I explain to them that there's a potential for herb and drug interactions and it might make them more sick from their treatment or make their treatment not work as well, they're much more open to not doing that. If I'm open to having that conversation, then they're more open to bringing things to me, but they also feel heard and validated in what they want to do. And then they have more understanding of why they can't do something, as opposed to kind of the feeling sometimes that patients might have of, oh, my doctors just don't care. They just don't want to hear about it. And then they're doing it kind of on the side. So just opening up the conversations is the most important. And then digging a little bit deeper, if there's more that you can do, by all means, maybe you can do some acupressure, maybe you can do some aromatherapy. Some of these things are pretty mild and low risk. And so it's very possible, depending on your institution and where you're working, that you might be able to implement the more benign therapies, for lack of a better word. The next one, and obviously very important, is oncologist buy-in. So this is where you potentially are working with someone who is not at all a believer of integrative medicine, of anything that we do, and they don't want the patient to do anything. This is a little bit more difficult to address, but I think using the evidence that we have, we can change minds, right? So I've had this experience as well, where a patient came and said, the oncologist said I could do acupuncture, but there's no way I could do this, whatever particular supplement it was. And so I pulled up the research on that particular supplement. I sent it to the oncologist and I said, well, the patient mentioned that you didn't want them to take this specific thing. I just wanted to give you the information about it and reassure you there's no herb or drug interaction, and I think it might be helpful. Would you be okay? And he said, oh yeah, sure, that's no problem. So sometimes it's just lack of knowledge. So engaging the oncologist and talking about what you want to do and why, and giving them the supportive evidence can go a really long way. And then the more that the oncologist starts seeing, oh, that really did work. Wow, I sent that patient for acupuncture and her hot flashes got so much better. The next time it comes around, he or she might be more willing to do that. So I think just having those conversations are really important. And then if you can find an in of something of that particular symptom that practice is having, and find something that seems, again, low risk and potentially helpful, that's another way to kind of gently introduce it and maybe start changing minds a little bit. Opportunity. So this is a tough one. The time, where are we going to find the time to do this, right? I have worked, again, in a variety of settings, inpatient, outpatient, in the hospital, in a doctor's office, and it's always difficult, no matter where you work, to find the time to be with patients and really talk about these things. One thing is you can, we do it anyway, right? We're talking and examining, oh, how are you having any symptoms? Are you doing this? Same. You can, as you're doing maybe vital signs, if you're doing that, like rapid blood pressure cuff. So let's talk about, are you taking any supplements? Are you doing anything? Oh, your blood pressure is a little bit high. Are you doing anything for stress reduction? Just trying to find these little ways to get in. It can be great. And I think opening page, like, oh, I never thought of that. Even just one small suggestion can really make a difference. And then if you have a little bit more time, that is always better. Obviously, if you can find 15, 30 minutes to really hash something out, maybe in between patients, or even sending, I don't know, portal message or whatever the patient, facing communication is, sending them resources that way is also really helpful. And then, of course, a lack of training, right? If you don't feel qualified to talk about these things, how are you going to explain them to patients? How are you going to bring them up? This kind of imposter syndrome in a way. And this, I'm going to provide some resources in just a bit that will help, a variety of resources for education, certification, training, places to look. But I would say the first is just, what are you interested in? There's a million directions we can go with this, but what are you interested in? And start digging in there a little bit. So we have somebody that just joined our practice, and she has been doing yoga on her own, but she's really starting to get into aromatherapy. So she's going kind of down that rabbit hole a bit. Like, what does that mean? How can I use that with this particular population? What is the certification process? If you find, again, the same symptoms keep popping up, like say chemotherapy-induced peripheral neuropathy, maybe you want to start looking into what are the ways that we can help improve that, and what can I make recommendations to for these patients? And then if you've always had this desire to learn acupuncture or massage, then you can dive in there as well. So again, I'm going to give you some resources. So most importantly, I think we want to be change makers, right? The status quo isn't going to get us anywhere. So we really want to try and push the envelope in a safe way, using evidence-based. That's the other really important part of integrative oncology, right? We have a strong evidence base, and we're always trying to push the field forward that way. So reach out, talk to other nurses, talk to other staff members, talk to the patients, find out. You'll see as you open up these conversations, you'll hear some of the same stuff again and again. There's these trends that kind of happen. So get knowledgeable about what people are talking about, so that then you can start really informing them. Talk to your institution, get engaged with the nursing leadership, and try and make change that way. I'll give you another example from my institution. Some of the nurses were doing a PICO project, and they found that acupressure was helpful for chemotherapy-induced nausea and vomiting. And the evidence base was very, very good. It was something that could be easily taught. And so they created a patient education tool, and then it became part of the Department of Nursing orientation. So as new nurses are coming in, they're automatically learning this. So you can really affect major changes in the institution as long as you, make the right connections. Okay, so here we have quite a few training and education resources. This is by no means an exhaustive list. And if you have any ideas of, training resources, please pop them in the chat. I think that would be so helpful. The Memorial Sloan Kettering Cancer Center we have a Fundamentals of Integrative Oncology course. This is currently not CME. There's no CMEs associated with this, but we are hoping to get some, so that will be really nice. But it's still a really good basic course. Drexel University Online has a certificate actually for complementary and integrative therapies. And the University of Arizona has a fellowship program in addition to this kind of introduction course. So I believe the fellowship program is 2 years, and it can be done remote. And all of these actually can be done remote. Some of them you might have to go for, a short period of time, like a few days or something, but these are all can be done online. And then University of Michigan, they used to have an integrative oncology scholars program. I don't know. I think it was paused in 2022. I'm not sure if they're running another one in 2023, but I put it there because they might have another. University of Minnesota has a DN piece and then a certificate and a minor for integrative medicine. Pacific College is based in New York, and they have a few different options, but in addition to a holistic nursing degree, you can get certified in cannabis, acupuncture, and massage through them. The acupuncture would be in person, and the massage, because you have to obviously show your skills, but the holistic nursing certification can be virtual. And then Maryland University has a whole integrative health center, and they have different courses and certificates there. The Smith Center, Institute for Integrative Oncology Navigation, Patient Navigation, Cancer Choices, and then the Israel Institute of Technology, Traditional Herbal Medicine and Supportive Cancer Care. This is new to me. I got recommended this from somebody in the SIG. I thought it was really, really interesting. And apparently a few people have taken it and really liked it. And then the Metabolic Terrain Institute of Health has their master practitioner course and then also an advocate course. And then just a couple other resources are the societies. So of course, SIO, the American Holistic Nurses Association has training. It's also a great, they have a conference every year. It's a great society to be a part of. Open Nurses is for the psychedelic assisted therapies. Again, this is pretty new field, but I think very interesting. And then Oncology Nursing Society. And again, if you can think of any others, please pop them in there. And last, I just want to thank the Nursing SIG and in particular Heidi, Susan, and Linda, because it was they were a huge help. They did the interviews and helped put this together. So thank you all, and came up with the idea. And that is me done. There's some references, and now we're going to go to the Q&A. I'll stop share. Now, I know most of you guys can't, I think because it's a webinar, we can't ask questions, but please, if you have questions, toss them in the Q&A and I will grab them. Let's see, is offering integrative modalities a requirement to be NCI designated? Not to my knowledge. Are there hospitals that offer integrative oncology but are not NCI designated? It's possible. It's very possible. I'll actually, I worked in my last job. I, again, was kind of more traditional nurse practitioner, oncology nurse practitioner, writing chemo orders and labs and all that jazz. But we developed a program there for massage and music therapy and art. And actually we had some dance. It wasn't dance therapy, but we had some people coming and doing salsa and stuff with the patients. So I don't think that center was NCI designated, but we had some integrative modalities. What needs to be done to begin incorporating evidence-based integrative therapies into our nursing education programs around the world? It barely gets a passing mention in nursing schools in my country. Oh, that's a good question. I think this is where we really need to start touching base with our nursing administration, right? So getting in touch with the people that are running these nursing orientation programs, nursing education programs, to help inform. I think there is a thirst for this knowledge, but people don't really know where to start. And so getting it out there, hey, listen, people want this, right? Look how helpful it is. Might be a way, I guess. I'm not in the education sector, so it's hard to say, but I would think if you create an integrative program, people are gonna probably start signing up for it. And then that just shows. One of the things I did recently was just did a little like mini pilot almost, right? I'm gonna just throw this out there and see if people pick it up and see what happens. So that might be another way, maybe even just hosting like a session, an informal after class session of integrative oncology for nurse or integrative modalities in nursing. And when they see, wow, look how many people showed up, then getting out there and starting to maybe develop some programs. Are there any program developers in here that have some thoughts, please. You guys can also answer. And then, oh, hang on a second. I want to go back. I was going to look at the chat too, because I see there's a couple chats. I just want to make sure I didn't miss anything in here. Oh yeah, so Jennifer created a functional oncology practice after becoming certified in functional medicine through the Cleveland Civic Clinic Center for Functional Medicine and IFM. And she's currently working in virtual practice through a functional medicine platform. That's very exciting, very cool. I think functional medicine is really, really interesting. And then Linda, in Canada, nurses can apply evidence-based therapies if they have sufficient training and education. Yeah, but often their institution's policies take precedent. I think that's true regardless, right? So we need to get in there and try and change these institutional policies, show them the benefits to patients and to nurses too. And then Laura, cancerchoices.org, NCI designated cancer centers. Oh, there you go. Perfect. Thanks, Laura. I appreciate that. Jennifer, treatment plans are built based on each type of cancer and its hallmarks on cancer molecular networks and tumor microenvironment. Cancers have specific molecular networks and tumor microenvironments where the cancer thrives. Yeah, supplements are effective and supported by National Oncology Group. Great, that's great. Laura works in a very conservative health system, but was able to get administrative support to train nurses in therapeutic touch. Exactly, right? Some of these things are so benign. Therapeutic touch, how harmful can that be? Heidi, my co-presenter, is doing acupressure for help with people getting their bone marrow biopsies. So during a painful procedure, can we do a little bit of acupressure? I think even music would be a great opportunity there. And then Laura also plugged in a link for some integrative medicine training programs, so please check that out. Oh, okay, yeah, the Scholars Program was 5-year NCI funded, so it ended. I thought I didn't see it again. It's a bummer. It looked like a great program. Funding is a limited factor, right? Yeah, keep them going, advertise and disseminate. That's true. Yep, I know. But do you think, Linda, just out of curiosity, if you have, if you show a lot of interest, that you could garner more funding? I'm just curious.
I also, sorry, I just want to add in here, because we have a good group. I will be able, if somebody reacts and raises their hand, I will be able to give them audio functionality for them to talk live.
Oh, nice. Yeah, if we can have a chat, that's even better than me reading. Oh, Heidi popped in a program. Her friend is graduating from jpu.edu. Linda has a question.
No, I was just going to respond to your comment. You know, I think, yes, if you're able to kind of drive enough interest, but often it's just getting that initial funding, I think, off the ground. Because my experience is that, you know, if you're looking at a traditional kind of nursing school or nursing program, or if you're looking at something with the, you know, that's situated within a cancer institution, often the powers that be and the people that are holding the money perhaps do not see integrative oncology as being a priority. And so in order to kind of get that space and the resources needed to put on, you know, an education program, that has to come from external sources, which are often hard to kind of, you know, pin down. Even being in nursing, I find that we have less access to, you know, funding resources than perhaps if you're coming from more of a physician perspective. So, you know, we've tried to get some things off the ground at a national level here in Canada. And, you know, the limiting factor is always getting the education, because you often can apply through a research program because they don't see it as being research. And we don't really have any pots of money that are really specific to education. And might be different though in other countries.
Yeah, that's a good point. What about like education grants? Do you have that or no? Or it's just not specific for integrative stuff?
We don't have those, no. So like I say, I think it varies from country to country. And the other thing too is I find that, if you're not educating our undergrad nursing students around it, that, it's the odd individual that has an interest in it. And so, without kind of piquing their interest and giving them a foundation, it's really hard to kind of create anything that's kind of post-secondary, continuing education that we have sufficient nurses that are interested in.
Yeah, oh, that's a good point.
Yeah, I'd like to just also add, I would love for nursing schools to take on the need for helping our future nurses develop self-care practices, and how can we weave in education around integrative medicine, maybe not specifically for oncology, but integrative medicine, and weave that into how nurses can also care for themselves using complementary therapies. I think if nothing else, this pandemic has really shone a bright light on the need for us to take care of our own for right now and ourselves. And I just think it would make sense to kind of weave it together, because as we personally experience something, you're more likely to be an advocate for that for your patients.
Yeah, absolutely. Yeah. It's funny, I'm actually part of a wellness task force for the nurses and the APPs here. And one of the things are yoga, meditation. We went through like a whole meditation course. So yeah, absolutely. I think you make an excellent point. Laura, you had a question, or you had a comment?
Well, yeah, it was kind of a comment when I think you asked about grant funding for educational programs. And Smith Center for Healing in the Arts for many years had a residential week-long experiential training in integrative oncology navigation. And of course, that became difficult to sustain. I mean, we were getting grants and we charged tuition, but a lot of people needed scholarships, et cetera. So we decided to develop an online virtual training, self-paced. Again, we had to get grant funding, but it was, for something that'll be available indefinitely, it costs less than doing one of the on-site programs. Of course, you miss the experiential piece, which is partly what Susan's talking about for the people who are teaching others or doing integrative care, how to care for themselves. So we missed that piece in there to some degree, but yeah, we got grant funding to do the online training. Of course, you have to hope you get more grants to like revise and update and that sort of thing. So it's a constant work to sustain what you're doing.
Do you think that, does anyone think that with the pandemic and the kind of highlight on nurses throughout that time, that there may be more funding for stuff like that for self-care of nurses?
It may be something hospitals are going to have to do if they want to retain their staff.
Yeah, I'm not actually familiar with if the ANA is offering anything other than, they do offer supportive services for nursing, but I don't know grant-wise if they're offering that specific to that. But I agree with Laura that healthcare institutions are going to have to really be upping their game in support of this in order to be competitive in a very skinny job market.
Yes. The other thing I want to mention, I didn't get to go to the Oncology Nursing Society Congress this year, but someone who did go said right in the middle, I think it was of the exhibit hall, and maybe somebody on the call went, there was a big section for healing. And so they had stations, from what I understand, with various types of complementary therapies and lifestyle practices there that the nurses could go and do and take a little break. So they get to see, how it feels for themselves and recognize the importance of it. So We're trying to, through Cancer Choices and a grant we have gotten to do integrative oncology education for oncology nurses, we're really trying to work with ONS and see what we can offer them. So I was really thrilled to hear that they had that. Brittany, are you on? Brittany would know.
Terry has her hand up. I don't know if Terry, if you want to.
I just had something on the funding line, which I think is related. So thanks for passing me the ball. So I'm a researcher, just curious about how to increase integrative oncology all around. So that's why I'm sitting in on the nurse session. But there's recent data that's from a year ago, that less than a year ago, that 60% of oncologists in the United States already believe in integrative oncology, support its use, both during treatment and into survivorship. And so my point there is, like, find the champions, like, don't be afraid to network a little bit within your own institutions or even to ones nearby, that there might be a doctor who just you haven't had the conversation with yet, who could help, with the funding angle. And then the other thing is the administrators, what they need to hear is that there's a patient competitive angle to this. So the data from last year again says 40% of cancer patients, this is 1,000 patients in the United States, representative sample that is across all cancer types. 40% of them said they would have switched hospitals if they knew there was more complementary medicine offered versus what they got in their current treatment. And another 35% said they would have been extremely more satisfied with their treatment if they had gotten more complementary added to their traditional. So I just think it's something that getting that kind of data out there and showing people is really important, and that'll help also with the kind of the FOMO, like, make your administrators afraid they're going to start losing their revenue stream. That's what it takes to get through to those people.
Yeah, I love that. That's great. Those are great statistics. Yeah, it's all about dissemination always, right?
Right.
I was just going to follow up on that point. That, I think that's a real driver right now are our patients and patient advocacy communities. And I've really tried, I'm in a healthcare system that is, it's public. So it's a different funding model. And so it's really hard to convince, the powers that be to put more resources behind something because it's all publicly funded. However, there is starting to be a slip towards, fee for service. And more agencies, I think, are getting excited with the idea of being able to offer these, additional therapies that people are seeking out in the community and perhaps having them under one roof. And I think nurses could really be leaders in running those programs, as you eloquently, mentioned, but also in terms of providing some of these services. And we're getting more and more of a focus on patient satisfaction with care as being an important outcome of care. And definitely we know that these types of therapies can improve people's sense of satisfaction, as well as help them with their mental and physical health and recovery as well.
That's great. Yeah, a nurse-led integrative center. That would be fantastic. You could really cover everything with that. Jennifer,
I'd be up for that.
Jennifer also said, yeah, we must all work together, all modalities, in addition to RCT-based pharmaceuticals. Absolutely. Yeah, absolutely. Are there any other questions, comments, thoughts, please?
I did want to share this. I'm just curious what other people's experiences have been, perhaps even like Laura, with your training program. We developed a training program called Cameo many years ago in Canada. And we did develop a small workshop that, we had nurses as well as some pharmacists come, and it was a 3-day workshop. And it was really about supporting patients as well as their caregivers around making decisions around complementary therapies. And we thought we did a pretty good job, but at the end, what struck me is probably about 70% at the end said, well, I'm not allowed to actually speak to patients about this, am I? I'll have to check with the doctor before I'm allowed to do anything like this, even though we do have, scopes of practice that, enabled nurses to have conversations about these therapies if they had training and education. So to me, there's still that hurdle of almost gatekeeping around nurses' care, at least here in Canada. And just, giving them the confidence to speak about this, talk about their knowledge, share the evidence, and maybe overcome some of the interprofessional issues on a team, particularly when you're in a setting where there isn't an integrative healthcare being offered. So I don't know what other people's experiences around that.
I think that's a great point. And I think that's one of the things that I was trying to get across is that you are allowed to talk to patients, right? You might not recommend a supplement if the oncologist you're working with is very anti-supplement, but you can at least talk to them about it. And having those conversations helps the patient feel heard and seen and will make them more open. And in that, maybe you can also help make the oncologist more open, in the conversations as well. But yeah, you're right. There's Laura, go ahead.
Yeah, just to riff off of that, when Smith Center was developing its integrative oncology training, I'm not sure what we said, but we were going to do a presentation to the Academy of Oncology Nurse Navigators. And, to their credit, they wanted us to be clear that we were not recommending therapies and that we're not allowed to do that, quote unquote. But so what we did was change the wording of what they do is to guide patients in the responsible selection of complementary therapies and lifestyle practices. So you're not prescribing, you're giving them information, you're showing where information is, you're helping them think it through and make their own decisions. But certainly we can do that.
Yeah, education is the key, right? We're allowed to educate our patients, I feel like. So as Heidi had mentioned that as well, talking about cannabis, even just, what are the risks? Where would you not want to use it? Just kind of, and obviously this depends on the legality of where you live, but just having the conversation is really, I think, helpful.
Yeah, I remember hearing an integrative medicine, not necessarily integrative oncology physician saying, oh, well, the doctors, they're going to decide what educational materials handed out in the clinic. And I'm like, no way. Everywhere I've worked, it's been the nurses who pretty much picked out, what information they were going to give people about their chemotherapy. They probably ran it by the oncologist, but I really feel like the nurses are the empowered ones to choose good materials, including information on integrative oncology. So I really think this is the group to reach.
Yeah. Any other questions or comments? It's a great conversation. Thanks, guys. I really appreciate it. I love hearing, especially from the education sector, because I'm not in that. So I think that's really important points. I think that might be it, Morgan.
Okay, great. That's it for our questions. Thank you for all of our attendees. Oh, wait.
Oh, yes, Linda and Susan. Someone is in the chat. Haven't heard back. They want to be a part of the SIG. We'll get you in. Don't worry. We're very open and welcoming.
Just send us an email or send Morgan an email and we'll get you in touch.
Yes, Sarah, I can follow up with you in the chat with my email. Thank you, attendees, for joining us and participating today. As a reminder, this is recorded and will be put online. Please also join us for our next webinar in June on challenges in medical education training in integrative oncology and international perspective. If you have any questions about SIO or anything from today's presentation, please email us at info@integrative.org. I can also be reached at morgan@integrativeonc.org. Please be sure to follow us on social media to stay up to date with the latest news from SIO. Thank you again for joining us today. We appreciate your time. We look forward to future collaborations and have a wonderful evening, morning, afternoon, wherever you're tuning in from.
Thank you. Bye, guys.
Thank you.
Bye-bye.